For patients with stage 2B and C melanoma, we do consider giving them 1 year of uh, immunotherapy, which consists of the agent called pembrolizumab. This is an agent which is given intravenously every 3 weeks for a total of 1 year. Now, of course, any treatment has its share of side effects, and it's always important to balance the potential benefit versus the risks. In terms of the benefits, adding this 1 year of immunotherapy treatment reduces the risk of recurrence by about 40%. So this is a substantive increase. And we know over the long term that people who get the pembrolizumab have a lower chance of recurring both in the area of the melanoma, but also in other sites distant to the primary melanoma. And it's really this distant recurrence is what leads to people to succumb to the melanoma because its ability to grow elsewhere. So reducing the risk of this coming back both in the region and more importantly at other sites in the body is an important a factor in the benefit of receiving this treatment. Immunotherapy has been used in melanoma now for about 8 to 10 years. And we use it in patients who have advanced melanoma, whose disease is basically outside of where the primary treatment, where the primary melanoma was. And we've had major impact in improving outcomes in patients who receive immunotherapy. But by using immunotherapy for this long, we have a pretty good concept of the side effects that it would occur. And it's the incidence of these side effects that have to be balanced across the potential benefit of reducing recurrence rates in patients with stage 2 melanoma. The principal side effect of pembrolizumab is fatigue, and that occurs in about 40%. Its impact on the patient is variable. Some have noticed it in a major way and they have to adjust their lifestyle. But I would say most people notice it's more of a knowing side effect that their general energy level is down. Most people are able to continue on with their occupation, but there's some who really have to make major lifestyle modifications, but that's relatively rare. The other common side effect is rash, and this occurs in about, again, 30 to 40% of patients. Some people get a very severe rash, and other people get it very mild. The other thing that patients get fairly commonly is itchiness, and they can have itchiness with rash, or they can have itchiness without rash. And again, it is rather unpredictable. It's generally mild and we're able to manage it with using creams and antihistamines, but it can be severe. Rarely it can become so severe that treatment has to be discontinued. Other more common side effect is it can affect thyroid function, and it can cause the thyroid to become underactive. Usually the patient's unaware that this is happening, and it's something that we monitor with routine blood work. It can also affect the liver function. Again, it can rarely cause severe liver dysfunction, but it is something that we monitor closely with blood work. And if it occurs, we interrupt the immunotherapy and can treat it fairly successfully if it becomes severe. But the trick to managing the liver effects is to identify early, and that's done with blood work. Now, immunotherapy has other more rare side effects, and these can be quite a bit more severe and even life-threatening in some occasions. One side effect that we watch for closely, and the patients have to monitor for this, is the development of colitis. And colitis is a form of diarrhea where the bowel becomes inflamed. If this occurs, it causes increasing frequency of the bowel movements and abdominal pain and can become very severe very quickly. So patients are asked to monitor their bowel function, and if it occurs, then early institution of treatment can often reduce the intensity of it and even eliminate it completely. But it is something that we monitor for because it can rapidly escalate to becoming a life-threatening problem. Other more rare side effects can affect the pancreas and cause shut off of the insulin production. And if this happens, it's usually irreversible, and the patient will likely be a diabetic, requiring insulin for the rest of their lives. This is rare, but can occur in 1 to 2% of patients receiving this immunotherapy. Other more rare side effects, it can affect the adrenal glands and the pituitary glands, which produce important hormones. And these can be replaced, but if it's not recognized, can cause life-threatening complications. Rarely, it can cause inflammation of the lungs, and also rarely it can cause inflammation of the heart muscle. And again, these are important to be identified early and can be need to be treated, but they can become life-threatening if becoming very severe. So there's a very long list of potential side effects using pembrolizumab, most of which are very mild and manageable, but one needs to keep in mind there could be life-threatening and life-altering side effects in rare instances.